Good morning, Chair Hollendroff, Member Holmes, staff and guests. The lobbies are open and the recording has begun.
Thank you, Deb. I'm going to now convene the Washington State Liquor and Cannabis Board Caucus meeting for Tuesday, September 23rd. Board Member Garrett should be joining us here momentarily, so I'm actually going to stall for just a minute to see if she joins us before we get started. And if she doesn't join us in a few minutes, then we'll go ahead and get started since we've got two of us here this morning. I will make one announcement of a change to the agenda this morning. We're going to postpone the update at 10:30 for the Alcohol Advisory Council update by Member Holmes. And Member Holmes has said it's okay for me to let you know this, but he's just recovering from COVID and his voice is not quite back yet in full, fully. So we'll postpone that to our next board caucus meeting, and we'll proceed with the rest of the agenda as it's posted. Board Member Holmes, I know your voice is a little loud. Did you want to say anything at all or just acknowledge?
I'll try to get out that how relieved I am that our state has a governor who issued an executive order to make sure that the COVID vaccine is available. I made it 5.5 years fully vaccinated, and yet I let my guard down late August, early September, and really made up for lost time. So I just wanted, my PSA is simply remind people it's still out there. It's different, and it does take a while to recover. So thank you, Chair Hollendroff.
All right, well, I'm glad you're with us and that you're on the road to recovery. Okay, we'll go ahead and get started with the agenda. We'll start with approval of meeting minutes. So do I have a motion to approve the meeting minutes as they're listed on the agenda?
I move that we approve the meetings as listed on the agenda.
All right, great. And I second that, so moved. And with that, we'll move right into our first agenda item, which is an update from our public health education liaison, Kristen Haley, who's going to give us an update on the August Public Health and Prevention Roundtable meeting. So Kristen, welcome. Good to see you, and we'll turn it over to you.
Thanks. Good morning, Chair Hollendroff and Member Holmes. Sorry you're not feeling well still, Member Holmes. Thanks for having me today. I'm here to report out on the August 28th roundtable with Public Health and Prevention Partners. Board Chair Jim Hollendroff and I co-hosted this meeting. There were about 50 attendees, a blend of folks from other state agencies, local health jurisdictions, and coalitions, some other smattering of folks from different areas of public health and prevention. We kicked off the meeting with Justin Nordhorn providing an overview of House Bill 1515 rules development. He used the same basic presentation that our rules manager, Kevin Walder, has provided during public listening sessions. We kind of trimmed it down and tailored it a little bit, but it was the same basic presentation that you have seen. This served as a good starting point for Justin to field questions from these partners. Most of the questions were technical in nature, things like timing or, I saw this and I didn't understand what it meant. And so it was a good opportunity for us to give clarity. Then I provided a brief update about the alcohol product placement rules. At the time of the roundtable, the latest draft had not yet been published. And so I gave a walkthrough of the changes that partners could anticipate between the first draft and the one that's now posted on the website. Justin Nordhorn and I again fielded questions and comments from partners about these potential draft changes. They were potential at the time. Now they're real draft changes. And we encouraged them to attend upcoming listening sessions or to submit public comment. And then when that discussion sort of tapered off, we transitioned into more of an open-ended discussion period. We asked partners to share any updates with LCB around things like changes in their funding or programs they're kicking off that they want collaboration with LCB for, or any legislation that they have their eye on for next session. Really, we just kind of opened the floor, gave them some prompts, and then we're sort of ready to receive whatever they wanted to talk about. And from that discussion, we heard the following topics. So we heard a lot about interest in vapor product and cigarette flavor ban. LCB was attended as part of that discussion, was invited to attend a policy work group for a coalition called WA Breathes, which I now have the invites for and plan to attend. Then there were several questions from folks who work in tobacco prevention to gain clarity about current tobacco taxes and fees, which we addressed either live on that call or in some cases we did some follow-up with folks over email in the following days. And then we heard from some partners about policy changes at the federal level that have changed what FDA and CDC implement. And then that led to questions about the LCB FDA compliance checks. And we offered clarification that our FDA program is expected to continue, at least at the time that we had the roundtable. Department of Health also updated us at that time about House Bill 2320 bud tender training went live that same day, and they did a broader rollout the following week. And then one partner requested that LCB provide comment regarding two things. One, the federal rescheduling of cannabis, and two, the 2025 Farm Bill. So out of that discussion, our staff on the call basically drilled down to explaining that state regulations are still in place and there's a trigger bill for interstate commerce. And beyond that, there's not much more we can say without knowing what those federal changes will be or if they will be at all. So we tried to stay as accurate as possible. And then last in that part of the roundtable, we concluded with a partner asking about inversion and diversion. And they stated that they had some concern that there's more cannabis grown than is sold. And they asked questions about what happens to the remainder and how do we track this and that sort of thing. That's a much bigger conversation than we had time for on the roundtable. And so we offered to have a meeting with this partner where we would bring to the table folks from enforcement and education and provide clarity about some of those concerns. The partner hasn't reached out to set that up at this point, but we'll let you know if anything comes from it. And then after that open discussion, Justin Nordhorn provided a timeline update for the cannabis advertising rules, mainly that the Sierra 101 would be filed at the end of August and to look out for engagement sessions in the future. Then I closed us out with just a couple reminders. I let folks know that the Healthy Youth Survey registration is open, as many of the attendees at the roundtable influence whether the schools participate in the survey. And then I also gave a very excited plug for the rules dashboard that's coming soon. The next roundtable will be co-hosted with Member Holmes on October 22nd, which somehow it's like a month away already. And then that one will be with folks from the cannabis community. And then the combined roundtable that I think a lot of people are really excited about is between the public health and prevention folks and the cannabis community. And that will be co-hosted with Jim Bollendroff, Chair Bollendroff, in November on the 19th. Oh, that's it from me. I'm happy to answer any questions.
Great. Thank you so much. And thank you for being so gracious to say that we co-hosted when in fact my internet was backed up that day. So thank you for really covering that meeting. I think it was great. I did have a question about the number of attendees. I was very pleased with the number of attendees. And was that a higher number than usual, or I just seemed like a lot of people on there, which I thought was great.
I'm laughing right now because I also was going to gush about how many attendees, 55, but then I went back to some of my other notes and we've fluctuated between like 40 to 70. So 55 was right there in the middle. Yeah.
Okay, great.
Which is understandable. You all should know a lot of our public health partners have recently been laid off or they've been bumped into different positions. Their funding has been cut. And so I think we might need to stop measuring like volume of public health partners at these types of things because numbers are reducing based on just the state of the field right now.
Okay. The only other question I had is related to the bud tender training. I know that had just kicked off, and then you said that they did a more formal kickoff of some kind. Have you heard anything else or any feedback or any additional things since that meeting about the bud tender training?
Yeah, in fact, I've attended a couple of meetings with our colleagues at Department of Health where they've given updates or presented on some of the initial data from the quiz that's at the end of the bud tender training. So they've reported out on the number of people who have taken the training, unique numbers and repeat numbers. And then they also have some data about how many times people take to pass the quiz, which kind of tells us about retention and knowledge gained by the training. And I was thinking it would be great to bring them to a future caucus meeting and present that data to you all. Maybe give it a couple more months so they have a little bit more robust numbers. But I think you all would be really interested to see those results. But the overall is lots of people are taking it. I don't have the numbers off the top of my head, but they do have that. We could bring them to share that with you.
Okay, great. Well, that would be wonderful. So you and I actually are meeting later today, so maybe we can discuss
Okay,
that.
fine.
Great. Thank you so much. And thanks for
Sure.
doing such a great job of co-hosting that meeting and pulling together the agenda. Board Member Holmes, any comments or questions?
No, just thanks to Kristen. She also participated in the Alcohol Advisory Council relaunch, and I do look forward to co-hosting with you on October 22nd. Kristen, thanks.
Me as well. Feel better, please. Thank you both.
Thank you.
Great, thank you. All right, I do see that Board Member Garrett has joined us, but I have been notified that she cannot control her camera or mic, and I want to just verify, Board Member Garrett, one more time that that is still the case. You probably can't answer me, but if you don't respond, I will assume that that's correct. Okay, so
I'm also fading. My connection is fading in and out as well. Sorry.
Okay, well, I'm going to then do what we've done with the Alcohol Advisory Council update regarding the Cannabis Advisory Council update, and we will defer both of those agenda items to our next caucus or a future caucus, depending on availability of agenda space on the upcoming meeting. So with that, we will move to our final agenda item, which is board member and executive assistant reports. So anything from you, Board Member Holmes?
Was just going to add that I am testing negative. I didn't make that clear. It's just the aftermath. But I did very much enjoy the Alcohol Advisory Council. I'm very enthusiastic about the robust discussion we had. And I wanted to say that even though I contracted COVID after the meeting, I also have started my next current batch of wine based on grapes in our backyard. So I have 5 gallons that are fermenting as we speak. So I thought it was fitting that we had the Alcohol Advisory Council just on the eve of that.
For sure.
Thanks.
You really are diving into being the chair of the Alcohol Advisory Council. Thank you for that. And I too thought both of the Cannabis Advisory Council and the Alcohol Advisory Council meetings were excellent. And both you and Board Member Garrett did an excellent job of leading those. And staff really did a great job of leaning in and participating, as did the participants. You know, I think that we had some really good, fruitful discussions. And I look forward to continuing to have those meetings and get reports back from both you and Board Member Garrett at these caucus meetings. So thank you for that.
I was just going to remind everyone that the minutes for both meetings are posted after this meeting. We've approved them, and in lieu of a personal recap, which will come next time, the minutes are posted.
Great, thank you. All right, with that, Deb, do you have any thing to add to the agenda today?
No, thank you, Chair Volendroff.
All right, well, with that, I will adjourn the meeting, and we will see you at our next board caucus meeting. Thank you very much.